video, Management of Subretinal Cysticercosis by Simar Singh. Let's run the video. Thank you.
In this video, we discuss a case of a subretinal lesion in an elderly male. A 65-year-old male presented with decrease of vision in his right eye for the last 1 week. Posterior segment examination revealed the presence of vitritis with a yellowish subretinal lesion in the inferotemporal quadrant with surrounding occluded vessels. A cystic lesion with the presence of a hyperreflective focus on multimodal imaging strongly suggested the diagnosis of subretinal cysticercosis. The patient was taken up for a transconjunctival 25-gauge 3-port pars plana vitrectomy. A core vitrectomy was done with the removal of vitreous around the lesion. A small retinotomy was made near the edge of the lesion to access the subretinal cyst. Active extrusion was used to suck the cyst out of the retinotomy. Due to the compressible nature of these cysts, they can usually be removed through very small retinotomies. The undulating movements of the cyst can be appreciated here under light, which points towards the live nature of the cyst. The cyst is then lysed and aspirated in vivo with a high-speed vitreous cutter. A fluid air exchange was done subsequently, followed by endolaser around the retinotomy site and the capillary non-perfusion areas due to the occluded vessels. Post-operatively, the media cleared and the patient attained a best corrected visual acuity of 6/9 at 6 months of follow-up.
So I could see Dr. Mark Humayun was amazed during the removal, and it would have been very hard to stop watching that thing in the vitreous cavity, wouldn't it? So any comments or thoughts here? Flavia, any ideas? Have you had experience with this?
No, I haven't, but I would for sure detach the hyaloid first.
Yeah, I think this is the major point. I would detach the hyaloid first. It's safer for the patient.
Ray, would you have tried to laser this thing preoperatively or some way ablate it without doing surgical removal?
After a video like that, which was so satisfying to watch and I'm sure to do, I think this was a really nice approach. Again, I would separate the hyaloid first before entering the subretinal space.
Any other comments or thoughts about this amazing case? Yes, Matt.
Yeah, I think he did it just right. Removing it in toto is safer. You don't want inflammatory reaction. OCT has shown small amounts of subretinal fluid around the cyst, so it can be extracted without causing overlying retinal damage. Perhaps remove the hyaloid first, but he seemed to do just fine without doing that.
Yeah, Yannick, how about the digital audience? Maybe somebody out there has seen one of these.
Yes, and the question arises, do we have to be concerned about intraocular inflammation postoperatively from removing the cyst with the cutter? Is there any possibility of removing it en bloc to minimize that?
Yes, Dr. Singh, you heard the question. Is there a concern that when you chew this thing up with the vitrector that those contents will be profoundly inflammatory?
Yeah, this used to be a concern earlier, and it was advocated that the cyst should be removed in toto through a sclerostomy. But now with the kind of fluidics that we have and the high-speed cutters, we can just lyse, and the fluidics manages to remove all the inflammatory material from the vitreous cavity by the time we complete the vitrectomy. So we find minimal inflammation post-operatively in these eyes.
And there's a follow-up question. Would you use steroid post-operatively in order to further minimize any of that inflammation?
Yeah, steroids are given pre- and post-operatively both, but we should take care not to give any antihelminthics in this case, because if the cyst dies in the eye, then that eye is lost forever because of the inflammation that it
Oh, really?
produces.
So if the cyst in the eye, if it necroses, you're toast?
It's a very important thing that the neurologists send to us when they give for neurocysticercosis. They send for ocular screening beforehand so that they are sure that there is no ocular cysticercosis associated along with the neurocysticercosis.
Well, fantastic. A great case. Thank you very much.
Thank you.
We'll move to our next video. Early vitrectomy, restored drag